This is Bridging Health Care, and I am your host, Bridget. Thank you for joining me on this channel. The main focus is helping us to become highly effective healthcare worker, bringing informative, educative solutions to our world. I am so happy you're here. Sit down, relax, like, share, subscribe. Thank you. Hello guys, and welcome to my channel. This is Bridget from Bridging Healthcare. And how has your 2023 been? Has your year started right? I hope you're no more on break, because if you're on break now, it's no longer the holiday. The year has started and it is running. The days are running so fast. Just when did we say Happy New Year? This is Bridget from Bridging Healthcare, and I'm so excited you have stayed with me on this channel. If you have not subscribed to the channel, kindly click on the subscribe button, subscribe to the channel, hit the bell, share it with your friends and family so that whenever I post a video, you will be the first to know. So how has work been? And those of us that are still studying, how is it going? Are you having a good time? Are you getting ready? Have you started trying the things that we've been teaching on this platform? If you haven't, it's not too late. Let's delve into the meat of the matter. As a means of caution or advice, or just to say something that matters, that's in my heart, I want to just encourage every care worker out there, whether you are a support worker, whatever aspect of healthcare that you are, always remember one thing, that the people that you are helping are not able to do things for themselves. They are not able to do things for themselves, and that is why you come into the picture. So whenever you are carrying out your role, your duties, ensure that you are carrying it circumspectly, making sure that whatever you are doing is going to benefit the client. They are first. Okay, so that's just a charge before I go into the meat of the matter. Now, if you have checked my previous videos, I've talked about dementia. I've just pissed on it. I've pissed on Alzheimer's disease and a few other conditions. But today, I want to really break down how you can care effectively for a dementia patient. In the course of your career, you will definitely find a dementia patient. You will definitely care for a dementia patient, whether the patient is already in early stage or they're in the late stage. However the case is, it is something you will most likely find in your field of work. Therefore, it is important for you to understand what dementia is. If you don't know what dementia is, kindly look at my previous video. But as a means of general introduction today, dementia is a condition that affects the brain. So when somebody has dementia, it's a condition that affects the brain. So the brain cells begin to die due to either genetics or a side effect of something. So dementia is a very funny condition in that it picks a part of the brain, those cells begin to die, and when those cells begin to die, the use of that side of the brain is totally affected. So you find that the person is a bit forgetful. At the early stage of dementia, the patient is forgetful. The patient can even miss their way to their house depending on the late stage of the dementia. But basically, as a matter of explanation, dementia is a condition that stems from the damage to the brain nerve cells. And it means that the messages sent and received are not meeting each other. Remember when I talked about communication? So communication is a two-way situation where somebody says something and the other person receives it, and understands it and is able to carry out the action based on what was said. So in dementia, the brain nerves are not able to carry the messages as supposed. Therefore, you see different kind of things coming up. So there are different types of dementia. Under the dementia, you have the Alzheimer's disease, you have vascular dementia, you have dementia with Lewy bodies, you have frontotemporal dementia, and you have mixed dementia. And you can go to my previous video to study about dementia, and it's a very common condition. So many people have it, and it is on the rise. Therefore, when a client or a patient is diagnosed with dementia, they are told what it can do and how it can affect their everyday life. Dementia causes people to forget things. It gets to a stage where they might even forget to swallow. It gets to a stage where they might even forget that they saw you yesterday. They might forget the name of somebody that they remember. Forgetfulness is one of the first symptoms of dementia. And then depression is also one of the symptoms of dementia. And you can also find that the person will start losing weight. The person might forget to take water. The person will start losing weight. The person is irrational. They can be aggressive sometimes. Sometimes they are chatty. Sometimes they talk a lot. And sometimes they forget what they want to say next, and they don't know what they want to say next. So dementia is a very interesting condition, and it affects functionality. And over time, as of today, there has not been a cure for dementia. Therefore, they live with it. It affects activities of daily living. And therefore, a dementia patient will need support. They will need care, because it's difficult for them to complete activities. They may start something. They may even start eating and forget to swallow. They can have choking bouts. Those are conditions of dementia. They can easily trip and fall, because they can be walking and then they forget to continue moving. And it can get really frustrating for a patient when they want to do something and they don't do it because they forgot, or they are trying to remember something. So it can make them irritable. It can make them upset for no reason. It can make them irrational. And therefore, if you are caring for a dementia client, you have to be extremely careful. You have to be extremely careful. You have to take note of everything they do, every step they take. You have to watch them. Sometimes they don't know what they're doing. They can take something that might hurt them. They can take a knife, And when depression comes into the picture, depression is a topic I'm going to discuss in one of my videos. Just look out for it. Depression can make people, it makes people think that they are the problem. They look down on themselves. They totally want to disconnect from people, from life in general. So when somebody is depressed, you see that the person doesn't want to go out. If it's a regular person that goes out, the person doesn't want to go out. The person might not even want to eat. The person will begin to show you some traits that will make you think, what is wrong? Why are you not the way you are before? And then they are gloomy. They want to be alone, and then they are never negative. They are never positive. They are not motivated. Nothing motivates them. So when that is the case, if you are caring for that person, you really need to, you need to be prepared. And I'm just going to give us a few points, a few things that but as a background knowledge, it's important for us to know what dementia is and how it can affect everyday life. Like I said earlier, memory is taken. They lose the memory gradually for a dementia patient. So, somebody that normally makes tea in the morning to take will forget to make their tea in the morning to take. And then when you tell them, would you take tea? They're like, I don't take tea in the mornings. And they lose short-term memory and also long-term memories. So you've seen people that have dementia, they forget the names of their children. These are children that they named. It can be, and they have problem carrying out simple tasks because they have memory. They can be cooking now and forget that something is in the oven and it burns. They can be cooking and they don't know that they just brought down the food, or they don't remember and they put their hand on it and burn themselves. So you see people that are suffering from dementia, if they are not cared for, they have a lot of injuries, a lot of falls, and these are points that you need to know as a care worker. Their judgment and their attention is poor. So their sense of judgment is poor. They are not, if somebody, you can't leave somebody that has dementia to cross the road alone. The person can get to the center of the road and stand and forget that they were crossing the road. And that is hazard. Also, their attention span is shorter. So you find out that their attention is not there. You can take them shopping and they totally forgot what they picked, or so they must have a list. You see, you have to look for ways to mitigate these things. When you understand their condition, you know how to manage it. Now, if you are a live-in carer, that means that you have to understand their routine and draw out a schedule. And if you're a domiciliary carer, there's a care plan that you use and you must follow it to the detail. And you ensure that you do the same thing every time. So if the person wakes up at 9 a.m. and has oral care, and the way they do their oral care is that they take their brush from this particular spot and they turn on the toothbrush, and then you put a little bit of toothpaste and the water is warm. You ensure that you stick to that routine. Otherwise, you will get them frustrated and angry. Also, there are a lot of behavioral symptoms. People that suffer from dementia, there's a lot of changes that happen in their behavior as they grow old. Some talk. Some hide things. You can say, use your medication. I'm not using my medication. If you look at the person is looking like, oh, they know what they're doing. But it's the dementia, it's the condition, because if they know what they need for themselves, they will not decline to use medication or hide it or do something funny. So you have to also check, even when they're eating, you check that the food is swallowed. So how can you help your clients? Number one, stay calm. In any condition, stay calm. I've had to manage a dementia client before that. Once you dress her up, just before you turn your back to do something, she'll remove all her clothes. And I don't get upset about it. I'm like, oh, darling, you've taken it off again. It's cold. Let's wear it back. And then you hear, oh, okay, let's wear it. To that person, you're just wearing it for the first time. And so you don't start telling the person, how can you be behaving like this? It's not their fault. It's the condition. So those are things you need to put in check. You also need to prioritize what is important. You need to prioritize what is important. What is important for this person at this time? Is it a strip wash? Is it oral care? And do that first. What's the first thing that needs to be done? Do what is most important. Start from there to what is least important. So a client just woke up, that the first thing is personal care. If they need to change their pad, if they need to change their clothes, do that first. And then you cannot go to, they want to watch TV. All those things can come thereafter. Also, give a day-to-day task. Have a proper plan. Give a day-to-day task to reduce the stress that you are going through. So have your care plan and follow it, and have where you keep everything. So if you have everywhere where you keep everything, you will know where to pick everything at every time. Also, give one direction at a time. One direction. Don't tell them too many things. You're telling them to do this, you're telling them to, they will get confused. Remember, the brain is trying to catch up. Also, use humor. You have to be a little funny. Make them laugh. Say things that are funny. You have to be, I was telling one of my colleagues, care professional, comedian, care professional, storyteller, care professional, cleaner, care professional, medication, care professional, social outing. We do everything. Everything in the book. Your eye must be everywhere. It's a very solid profession, I'm telling you. Now, if things are not going well with the client and you notice that the client is not responding well or is getting really, really agitated, slow down, take a break. Take a break. Don't be in a hurry. We must do this now. You don't rush a dementia client. You allow them. Take a break, then come back. Also, practice the same routine activities every day. If you like to play card, or if they like to play cards with them. if they like to do some kind of game, and then let it be a repetitive activity so that their mind is stayed on it. you know I will also advise that your clients. Try and find out their history. What did they used to like? What were they like 2 years ago, 3 years ago? What did they enjoy doing? What caught their fancy? Do they like to watch some kind of movies? Do they like to play some kind of games? Is there a particular way they like their hair to be done? Because when you know that person at that level, you will be able to give a person-centered care. I have posted a video on person-centered care. Person-centered care is key for a dementia client. Therefore, you must, as a matter of must, give a person-centered care. When you're dealing with a client with dementia. Dementia can affect anyone. And honestly, no one is actually truly prepared for it, because it comes with different things. And that is why you must care with compassion. You must understand that whatever the person is displaying, it is not their fault. Sometimes they even try their hardest and then they become irritable. And as of today, dementia does not have a cure. That means that the person can die from the condition. So it's good to make a good impact in their lives. Take them out, let them see the sun. You don't want to wipe a dementia. You have peed in your part. No, no, no. Do it gently. Treat them like you're handling a baby. And you yourself will be satisfied doing the job. So dementia is a is a global condition. And that's why, as a care worker, you have to understand it, read about it, understand what dementia is and how it affects their everyday life. That way, you will then be able to help them properly. I hope this video has been able to give you an insight on dementia and how to care for dementia clients. Thank you so much for always coming online, watching these videos, learning from them, using them to be a better person. I'm so grateful and I really appreciate. And I know that these videos, this channel has been very useful. I pray that it's a conduit for many people's growth and success as they progress in health and social care. Thank you so much. This is Bridget from Bridging Healthcare. Don't forget to subscribe, like, and share. All right, to have a fantastic time as you journey on your healthcare profession. Be effective, be efficient, be the best.